My name's Kerry Knight. I've worked for LPT for 16 years. Started off originally as a healthcare support worker, did my nurse training. I'm a learning with disabilities nurse by background, and then I've gone on to do the health visiting course through Leicester Partnership Trust to become a health visitor. I think my experience with flu is very personal. You know, I'm a nurse and a health visitor, but I never really understood the impact that flu could have until around 4 years ago. My son, who was 3 years at the time, you know, was completely healthy, born completely normally, had never had a course of antibiotics before in his life, so was fit and well. And then one day he was really, really poorly, and we thought, oh, you know, we didn't quite know what it was. He was having really difficulties with his breathing, and subsequently he ended up with admission to hospital, where they diagnosed him with having various strains of flu. So not just one type, he ended up having 3 types of different strains of flu, and this resulted in him having, you know, various course of antibiotics and different therapies with oxygen, and he had we spent 10 weeks in high dependency and 2 weeks in intensive care, where he was on you know, near enough being ventilated on CPAP. Subsequently, from having flu, he's now got chronic lung disease, and he remains on oxygen, supplementary therapy, antibiotics, steroids at the moment. And obviously this, you know, after having 3 months in hospital spell, you know, he's been left with significant health needs that he's under a lot of different specialists in the hospital. You know, this condition has affected, you know, his life greatly, you know, from his experience of just managing to play. You know, he needs to carry oxygen around with him all the time, you know, simple day-to-day things. You know, you think, oh, we'll just nip to the shop. Well, we have to think about, has he got enough oxygen so we can go? You know, if we're on holiday, we have to order extra, you know, medication, extra oxygen, make sure everybody's aware of their needs. You know, thinking about in school as well, is everything accessible? And, you know, I can't believe, you know, I always thought flu affected the elderly and everything else, but actually, you know, experiencing it firsthand for somebody that was completely healthy, out of the blue, if I can urge anybody to have themselves or their young ones or their children vaccinated, I think that's the most important thing that I could ask for anybody to do. You know, my son, you know, he's facing you know, not only hurdles and complications for the last 4 years, but this could be lifelong. And obviously at the moment he's healthy, but actually we don't really know what the future brings. It's daunting, you know. Obviously he's been out of hospital since this episode of flu nearly 4 years, and we've made small steps where he's progressed, but you know, that relies on him being well. And so each year, you know, myself, my husband and my other children and grandparents and extended family all have the flu jab, just so then we can make sure that we can protect him from anything, but actually to keep us all well. The future for him remains on him keeping well, otherwise his prognosis could be far worse, and it could have been far worse. I think it's not only for themselves. I think they need to think about their extended family and the people and the patients and people they come in contact, because, you know, whilst it might not affect you, it might affect one of your loved ones. Very often people and ah about the time and the availability, but actually, you know, it's very easy for them to access. You know, it is and actually, you know, how can we promote public health, because we're public health nurses, if we're not in the forefront and putting that message? And, you know, every time you know, one of our universal contacts is to see children when they're 2, and I always remind the parents that, you know, as their child is approaching 2, as they're approaching this winter, you know, please, you know, think about having the flu vaccination. If I can prevent anybody from having the same experience I had, you know, and my family still have, then, you know, what does it take to have the flu vaccination? What, 10 seconds? You know, and you've got that protection.